I think the most difficult thing has been managing the uncertainty and the anxiety that comes with it. Fortunately, as GPs, we kind of are used to managing uncertainty on a daily basis, possibly more so than other specialties. I think the barrage of information, the changing information, with the goalposts changing over the course of the pandemic, trying to make sure that we do our best for our patients, protect our family, protect ourselves, the information coming through about who's most at risk. I think that was the most difficult part.
I found the most difficult part of being on the front line during the pandemic that we haven't had access to the usual facilities and services that we're used to. Patients have found this very difficult when they've had either ongoing issues or new problems that they need seeing to or tests doing, and they haven't been able to get those sorted. There have obviously been new problems that have come up, and patients have found this very frustrating, which has then been passed on to us.
I think the hardest part about working on the front line during a pandemic is managing the amount of demand against the available resource to treat demand. Triage has enabled us to meet demands in a better way by directing patients to the clinician who needs to see them and is best placed to do that. That has meant a shift in delivery of care for primary care and indeed for patient expectations.
It's been heartbreaking to hear some of the stories our patients have told us, particularly around mental health and bereavement and particularly children's mental health. I think that's really most affected me.
There's also an awful lot of anxiety out there about the pandemic, which has been very difficult to manage because I think everyone's felt anxious. And it's been the conflict between our responsibilities to society, but also to the individual and managing their health needs.
Also about family. So some of the struggles that colleagues have had is taking COVID home to our families, to our loved ones, what to do for childcare if we become ill and we're not able to look after our children, making sure that we can get shopping in and having that time for self-care has been challenging as well.
I think what we've seen during the pandemic, the biggest thing we've seen is everyone pulling together in the same direction. Everyone wanting to do the best by their patients, the best for the family and friends, and going that extra mile, which I think NHS staff already did, but they're stretching themselves even further.
The feeling within general practice that I've found has been that everyone is in this together and we all have to support each other through a very difficult time. Nobody quite knew what was going to come, and there's been an awful lot of support and help out there. The communication has been fantastic between GPs and to GPs.
It's been a real joy to see surgeries pulled together during this very difficult time, supporting each other both physically with staff when there is staff illnesses or sicknesses, and of course mentally providing that psychological support during those most difficult of times.
I mean, I guess that's why people have come in to work in the healthcare field, is because they want to make a difference, and it was almost a kind of call to action. It was called to the front line. Let's kind of fight this pandemic together. And I think the majority of the staff that I work with have answered that call.
There's also been a lot of understanding to GPs that have had to shield or that haven't been able to work for a while because of the situation. And I think this has been very comforting and heartwarming to see.
Supporting the team has also been a huge factor, making sure that our team is equipped with all the latest guidelines and all the information that's coming through, making sure that we're completely up to date and doing all that we can. Working remotely has been a little bit of a challenge, but something that we've got accustomed to very quickly, using online consultations and then booking our patients in face-to-face when necessary and when it's appropriate to do so.
The availability of digital and virtual consultations has enabled us to deliver primary care in a way like never before, enabling patients to see, consult and be advised by their GP without the additional risk associated with travelling to the surgery and the risk of catching COVID or indeed spreading COVID. This has been a real boost during the pandemic.
primary care has changed dramatically. We know that you've made huge changes and sacrifices to adapt to the pandemic. Social distancing, PPE shortages and the fear of infection are making an already tough job even more challenging.
I'm working flat out. Working hours have gone out the window.
I've had to self-isolate away from my family.
I'm worried about my health if I catch COVID-19.
On behalf of your patients everywhere, we want to say thank you.